Dr. Michael Barnes here. Psychiatry across the lifespan. What an interesting topic when you think about psychiatry or psychiatric care being delivered to children, adolescents, adults, and geriatrics. Specifically, three different categories. You could say kind of children, adolescents versus adults versus geriatrics. I'm going to give you a couple pointers on each one. So children and adolescents, arguably the most important category of all of them, right? You want to catch something as early as possible, change the trajectory. What an amazing experience to help young folks overcome some of their challenges. I would say probably it's more complex, it's harder because you're dealing with the interplay of caregivers, parents, and other dynamics as little kids grow up. Certainly a huge demand in the field of psychiatry and child psychiatry. Now, adult psychiatry is probably the bulk of what I do, is treat adults. Obviously, I'm an adult, so I can relate to them maybe the best out of all the categories, and the bulk of the people that we see, at least in my practice, do fall into this category. And what's interesting is oftentimes their struggles are also interplayed with interactions with somebody in one of the other two categories. So while treating one category, you're actually kind of simultaneously treating the other also in some ways. Now, geriatric psychiatry, the big thing that comes to mind here is the physiology that comes along with elderly. Now, I really do enjoy working with the elderly. If we're lucky enough to, be elderly ourselves, I think that we would want clinicians that are enthusiastic and into helping them. So the way they excrete the medications is different. You have to dose things a lot differently for the geriatric population. And on a negative note, though, in the geriatric population, it's hard. I'll kind of open up about that. I'll be a little vulnerable for a second, but it's really hard on me, those cases, because unfortunately Mother Nature is kind of undefeated. But the kind of intrinsic value that I get from helping those folks, I can't really describe in words, and I really enjoy it and will continue to do so. So just kind of something off the cuff. Hit me up in the comments.